Okay. Hi, it's me again, Umaira, and I'm going to explain to my friend about a topic called how childhood trauma affects uh, health across a lifetime. So, adverse childhood experience, which is ACEs, is like a childhood trauma that, well, a child faced, like for example, like abuse, neglect, physical abuse. I mean, like physical abuse or parental substance abuse, basically, and violence, addiction, and growing up with violence. I mean, and what is the impact on the brain and body? Well, kids who face constant stress are going to constantly release stress hormones. For example, cortisol and adrenaline. Um, and they release it like too often. So if they release the hormones too often, it's going to damage or like prevent and affect the growth of brain, weaken the immune system, and alters how DNA is read and transcribed. So we learn in biology if DNA is read wrongly, it's going to cause some health problems sometimes, right? And children exposed to ACEs are more likely to get a chronic illness compared to those who does not have. They're also going to have difficulty in relationship, have hard impulse control, like they're gonna have a hard time controlling themselves, basically, and they're gonna have trouble in the relationship. Also trouble with learning, like we study, we might think it's hard, but for them it might be even harder. Yeah. And it also, children with ACEs also have a higher risk of getting a lifelong health problem. Um, for example, like heart disease, stroke, diabetes, depression, anxiety, and maybe some substance abuse. You understand what is substance abuse, right?
What is substance abuse?
It's like substance is like drugs, like drug
okay.
abuse. And for example, a child that have 4 or more ACEs, and what I mean by that is like they experience maybe physical abuse, and then parental substance abuse, and then that's two, right? That's two. Maybe more is neglect, and one more is maybe growing growing up with abuse, maybe like that. That's 4 ACEs, right? So they're if they have 4 or more ACEs, experience 4 or more ACEs, they're gonna have a higher risk of getting a chronic illness, and compared to those kids who does not have any ACEs experience. So basically it's like if they are abused, or they have like childhood trauma, they're gonna be, how do I say this, because their immune system is weak, they're gonna be, how do I say this, they can get those chronic illness easier, like much easier than those who does not have experience ACEs. So
The risk of them getting
they just can get ill easily.
Yeah.
So from that we know that childhood trauma is not only psychological illness, but also a medical problem that need to be addressed. However, if the physical symptom can the physical symptom can be prevented if the root cause is not found. Like the root cause is like the childhood trauma, the abuse, the stress that they feel before. So how to prevent those is like you need to have early intervention, like from 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 when you're a child. Like you need early intervention. For example, going to therapy so that they can be less stressed and it can heal the trauma slowly. And supportive adults can also help buffer those illness. And health professional like hospital doctors at the hospital also should address those illness, like how they address a normal illness. Like they need to focus on those on the child who have issues, who experienced abuse before, because they're gonna have, how would I say this?
Big impact in their life.
Yeah, basically like big impact. Like
They're not treated.
if they're not treated, then they're gonna get ill. Like it's like the same level as those who just get ill, just get cancer,
Yeah.
like from family. What do you say again? Ancestors. From the ancestors, I guess. And then the conclusion is tough experience during childhood are not only going to give them psychological problems, but also are going to give them health problem. Yeah. But it can be prevented if there's intervention from early on, like when they're still a child, and then the illness can be prevented. However, you still need to address the root cause, or it still won't be. Yeah. Understand, right?
Yes, I understand. I fully
Okay,
understand.
that's all. Oh my God.